Hello, welcome back to Search with Sean. This is a special show today. Obviously, something I go on a lot about on this show, about AI and its involvement in the healthcare sector. And yeah, something I'm quite passionate about, obviously, because my day-to-day job as the SEO manager at Macmillan Cancer Support. But, you know, there's plenty going on in this space. Like 80% or over 80% of searches around healthcare come up with an AI overview, for example. You know, we know about ChatGPT Health coming into play. Claude have got their own healthcare thing now. And we know that a lot of people are using large language models for health information and advice. So there's lots going on. But also there are some good things coming out of it. There's like dedicated models like openevidence.com that seems to be a bit more trained on the kind of things we want to see. And also there's lots of advancements in the science world, you know, with AI helping in that kind of space. So, you know, there's good and bad. We're going to talk through all that, get people's opinions. And yeah, AC, I've got a stacked room. So I'm going to stop talking. We're going to get into it. And the first question is basically, should AI be involved in health at all? And where's the line? You know, and kind of what does good look like in terms of healthcare and AI? So I'll kick off with James. If you could start this, obviously, like we said, just intro yourself a little bit and give us your thoughts, I guess, initially.
Thank you. Yeah, hi, I'm James Davidson. I am a former doctor. I now run a search marketing agency called Riot SEO. So as a doctor, I'd left the NHS before any involvement of AI. Maybe we had some very rudimentary stuff. I suspect as an NHS doctor now, you might not see very much of it at all. Anyway, my brother's a pharmacist and he hasn't seen anything impact his pharmacy work in terms of day-to-day. So I'm coming at it from a perspective of kind of patients out there searching for information and learning. I guess from my perspective, yes, AI is going to be involved in healthcare. AI is going to eat the world. There's too much money. There's too many powerful people pushing it. And it is amazing. And I use it every day for my work. I use it a lot for my own information. I guess the danger here is, should the publicly accessible models and things like ChatGPT, Claude, Perplexity, should they be used by patients now, people searching health systems? Absolutely not. I think it's really dangerous, really wrong, and people are doing it anyway. So it's too late. We can't stop that. So just got to think about how we can educate people on the fact that it's going to get it wrong quite a lot of the time. I guess in terms of use cases, that's where I think about things like open evidence, and I've spoken with people at MedWise, which is kind of another more health focused, has got more guardrails. Basically, the better the data going in, the better the data coming out. And so if we can get models and healthcare specific platforms that help people with their symptoms, help people maybe not get all the way to diagnosis, but kind of get them in the right direction, great. When it comes to people searching their symptoms in these ChatGPT and that sort of thing now, I would say at the moment is quite dangerous. And whilst people love it, I guess the way that I would see it is, if I'm searching about things I know nothing about, I think ChatGPT is awesome. It tells me everything I need to know. It gives me so much information. If I ask ChatGPT about things that I do know about, I think, oh my God, it has no idea what it's talking about. And so I guess that's the education part of it, that it's so helpful. People are going to use it. But at the end of the day, people need to know that the way that this should be used is alongside humans and people that are helping guide them through that process and that have experience, and that it is just guessing at the end of the day. It's just a mathematical model that's guessing what the best answer is based on a lot of data and sort of expert input, but it is just guessing.
Yeah, I really resonated with that point you made about when you know about a subject. Because I was doing some work yesterday and I had to correct it so many times. But have you even looked at the document I uploaded? Because it doesn't say it actually what you said. Let's go get a different perspective from Sarah. Put you on the spot. What do you think? And
So hi, I'm Sarah. I'm the founder and director of Impulse Riot, a marketing agency, and also the CMO at a company called HealthyLine as well. And my background's in psychology. So looking at AI and health information from a psychological perspective, I actually find it quite scary. Just how people are using AI and the psychological impact that's having on people. For me, the big thing that's happening is because of something called availability bias, where people basically just want information fast, they want it quickly. People are kind of, like you said, James, just blindly believing absolutely everything that they see on ChatGPT. So, for example, if they're putting in their symptoms, they're getting results. They believe those results, they're taking them to doctors, when actually, people are biased towards kind of like negative information, the severity of the information. That's kind of what stands out to them. So, instead of going on and being like, oh, I just have a headache, I'll go and take a paracetamol, they automatically, oh my gosh, I have a brain tumor, I need to be diagnosed right away, sort of thing. The other thing is, in psychology, there's kind of like a term that's been coined a few years back called cyberchondria. And that is where people actually Google their symptoms online. When they Google their symptoms online, when they look at it in AI, they automatically, instead of just thinking, oh, this is going to be great, I'm going to be absolutely fine, I sprained my ankle, something like that, they automatically assume that it is kind of like the worst case scenario out there. And because of that, anxiety levels are rising, healthcare costs are rising as well, because they're treating people who don't necessarily need to be treated in a particular way when they could just go down to the pharmacy, for example. Another thing is there's actually been cases linked to people actually dying because they've Googled medical information when it comes to like, can't remember the word in English, when it comes to pills and stuff like that. So there was a case where a woman Googled her parents' medication and she based it on what she found online, gave them their medication, and they actually died because she overdosed them unintentionally. Is leading to increase in things like Munchausen syndrome and stuff like that. So from my perspective, it's actually pretty scary when you see people let loose on the internet with so much healthcare information around.
Yeah, and we always say, like, the saying is knowledge is power. If you give everyone this huge amount of knowledge and data and stuff right at their fingertips, it is dangerous, and it's scary how fast they rolled it out, which is obviously something we talk about quite a lot. Geoff, I'll go to you, and same please.
Thank you. My name is Geoff Meakin. I run a agency in the UK called Healthcare SEO, and we help small and medium private clinics attract more patients. So from my point of view, in terms of, I think what's been said already is absolutely accurate, especially James's point about the fact that it's too late, kind of the genie's out of the bottle, as it were. And I don't think that it's going back in again anytime soon. So I think the horse has bolted, and it's just something that has to be recognised and dealt with now. So I think that the more important question is, whereabouts is the line? And I think it really comes down to diagnosis. I think that it's all very well researching symptoms, conditions, treatments, but once it actually gets into diagnosing people, that's when I think you're in really dangerous territory. And I saw a statistic from a study last year, I think it was carried out at Stanford, which showed that 15% of people trust AI as much or more than a doctor, which is obviously quite scary when you couple that with the fact that these AI models, they're so sycophantic and they tell people almost exactly what they want to hear. And there's also been cases, I believe, of these AI models almost acting as like suicide coaches, like reinforcing what people are saying. So obviously that's something that needs to be dealt with absolutely urgently. I think the other problem is that because the models come across as so competent, they miss a lot of the nuanced medical data. And just like you guys were saying, you put in things that you know about and it comes back with stuff and you go, no, that's not right. Or that's what everybody thinks, but that's missing the key detail here, which obviously the models haven't necessarily been trained on. So I think that's a key differentiator as well, or a key distinction to make. And I think there always needs to be that kind of human in the loop, somebody who's an expert that can actually say, yes, this information is relevant to you as an individual. I think it's really, really exciting, but it's also quite a scary time to be in this industry. So it's going to be interesting to see how it all shakes out.
Yeah, and I don't know who it was. I did say on the show before, it might have been a Google engineer or something, or someone who was in the, involved in the creation of, these AI models and stuff. And basically just saying that, it's one thing training the model at the very beginning on certain principles and guidelines. Once it's already been implemented and it's already out there, to then kind of re-engineer it and get that implemented throughout that stage, it's already kind of too late. It's extremely hard to retrain it after it's already kind of been let loose, and that's kind of the problem, I think. You really, when you're at a company and you're about to release this piece of software or something, you train the staff on how to use it, the risks and etc. before you release it to them. You don't, if you're going to release this to the public, there was no training about the risks and everything involved in it. It was just kind of out there and go and have a play with it. But we know humans, and we've seen what happened to the internet. It's not like it's not happened before. What it turns out to be. Gavin, from you, please.
Yes, hello everyone. I'm Gavin Williams. I'm kind of entering today's conversation from a kind of two perspectives, I suppose, because my career involves being a health and wellness writer, both content and copywriting, and I'm also still working part-time in the NHS as a specialist physiotherapist. So I can obviously I agree with everything that's been said already so far, and maybe add a little bit of perspective from what we're seeing in the NHS. As James said, kind of with your pharmacist brother, we're not seeing much in terms of the frontline influence of AI at the moment. There's call for and suggestion for just sort of things that would make it easier from a workflow point of view, even if it was just kind of, data entry and the menial tasks, which is kind of, I suppose, what we would hope AI would be used for, just to kind of replace those tasks that humans would be, better off using their energy on better things. But we don't have that yet. But to kind of agree with all the points that have been made so far, one of the things that I often think is that having information is not the same as being literate with it. And health literacy is a very specific thing. And having wide access globally to that same information doesn't mean that it's reliable or accurate, just as everyone's already said, really. So I find one of the things that my title, for want of a better word, is copywriter, but I kind of think of it as more ethical persuasion. And I think that's, if we're trying to lead people to the right path, I think I personally feel quite a big responsibility to make sure the information is accurate and it's evidence-based. And almost in a way, AI is kind of the antithesis of that, because it doesn't really scrutinize. It just picks up large chunks of information and lands them on your doorstep. And then it's up to you whether you think that's useful or not. So I think in a way I kind of see, and I'm sure everyone on the panel today in some capacity feels themselves as gatekeepers in that world. So yeah, it certainly has a place. It's not going away. And I think we now kind of have to ethically use it as well as we can.
Yeah, the trouble is, I guess, with it is, and we've seen this with obviously a slightly different topic, but with recipes, where they're taking, seems to be, good content from reputable publishers, but they're combining them together. They're adding in stuff from Reddit, which they trust Reddit, and they're making these Frankenstein recipes, as they call them. And it's like, separately, they're not bad. Combining it all together makes it incorrect, and that's the kind of thing that the models are kind of doing at times. So it's a tricky one. We, even if they are trusted publishers. Sophie, over to you.
I'm Sophie Randall. I'm the director of the Patient Information Forum. We're a UK membership body for any organisation producing health information. We run a trust mark for health information. which has got 10 criteria, all about things you mentioned, Gavin: health literacy, evidence-based, easy to use and understand and access. There's 150 organisations certified under that scheme, and Macmillan were one of the first to get certified. In 2024, we did publish a framework on the use of AI in health information, setting out really clear guardrails about how it should be used, there should be transparency about its use. And I think what we're seeing is we have got beyond the point. It is here to stay, but there are no guardrails in place on the large language models at all. And they are, really representing a threat to health outcomes. And it's how we challenge that, because we have a very unregulated industry providing a heap of information, awful recipes, dangerous information. We presented a dossier on this with Sean and other colleagues and sent it to Google with clear examples and screenshots of inaccurate health information, which Google did nothing with until The Guardian published a piece about it, and then they removed something that was really inaccurate about liver function tests. So there is no will or impetus, I think, on the big tech companies to get this right. They're just in a race to see who can dominate this space. So in my view, there is definitely a place for AI and for many of the things that you've mentioned, and it's really helpful, checking the readability of copy, coming up with suggestions around copy, translation, huge advances in translation. So there is a place. Can really be helpful when you're analysing kind of a load of user content and user-generated feedback on stuff, and doing that in a kind of more kind of quantitative way. But it has to be done within a framework and within guardrails to protect people. And what we're seeing is that isn't happening. What we hope is that will change. And there does seem to be a bit of a sea change at the moment. So we've just responded to the MHRA's consultation on AI in healthcare. And we've said that the large language models and Google AI should be regulated as medical devices, as other apps and health information provision are, because they are providing advice and people are acting on it. And to Farah's point, we've had extensive consultation and feedback from Mind, who are really concerned about some of the answers that people are getting. So people in a paranoid state saying, I think my neighbours are watching me, and getting advice to do about when your neighbours are watching you, rather than actually dealing with the underlying issue. So I think there is real danger in it, and I think that we need to regulate those platforms. I do also think we have to accept, as to Gavin's point around health literacy, people want quick and easy responses to their questions. So I think it's upon us as health information producers to provide that. And we have been trialling a AI agent with 6 of our members for the last 4 months, looking at it, drawing off a sort of closed model of their HIFTIC certified content that already undergone medical review, meets all the right standards. And that's looking really promising. But it has had to really be examined carefully for things like tone of voice and sensitivity. So we've had a mental health charity for one, we've had a baby loss charity for another looking at it. So there is a lot of work to do to get it right, and it's that work that hasn't been done. And I think the stuff on Health Bench, which is coming through, looks genuinely terrifying, because what they're also not good at is localization. And we're getting US healthcare system answers that are just not suitable or correct for the UK.
Yeah, you're doing great work, and I really appreciate everything you're doing. And I think that's the thing we have to realise, that AI comes in all different forms. It's not just the large language models and that kind of thing. That can be used in other ways, as we say about scientific breakthroughs and stuff. And the thing that does worry me about how you can manipulate these models, like they may have closed loops in certain ways, saying you can't ask it this, and then if you say, oh, can you tell me it in a nursery rhyme? Or if my grandmother was telling me, what could you adapt it for that? So there's so many loopholes, and it's never ending if you can work it in certain ways, because of how vast it is. So really interesting. Last but not least, Roger.
I would like to say, Roger Donald. I work for NHS England at the moment, and I look after sort of the content management systems and parts of the back end sort of infrastructure. So I've got a slightly different use case because I'm more not patient facing, I'm more about kind of business to business side of the information corpuses that we've got in orbit around NHS England, and there's hundreds of websites, and part of our challenge is the notion that these websites are being spidered and indexed by large language model. What's accurate and what's correct? What's duplicative? How old is some of the content? When should it be retired? And the fact that these spiders and LLM models don't necessarily care if you haven't governed your content particularly well. And so we're trying to kind of think about how we can use AI and large language models to create like a central golden corpus of accurate knowledge that's well maintained from the center, so that health professionals and people who want to do business with the NHS can kind of get timely and accurate answers to their questions about where do I go for, how do I train to be a doctor in this particular region, that kind of stuff. I think there's a really interesting and possibly there's like a cost benefit model there as well about having that central corpus that can kind of survive organizational change. So you're not constantly redecorating the kind of world as the NHS more and evolves into various different areas. I also have a little bit of experience in symptom checkers, but I'm not a clinician. But in a previous life, there used to be a service called NHS Direct, which was a telephone service that people could phone up for seeking advice and information on health conditions. And so a team that I led was part of working with clinicians to create the first online symptom checkers. So what I found interesting about that kind of piece of work was about how clinical assessment is done working with the clinicians. And so typically the clinicians were working down from a very high level of acuity. So is this patient about to die on me type of thing, down to a point of, okay, you're not going to die on me. I could probably, provide you with the relevant self-care. And what the patient expectation was about working up in completely the opposite way. So it's like, I don't want to start out, I'm about to die. I want to start out, I've got a sore throat, and go the other way. And so there's this kind of mismatch between the way that the clinicians were assessing patients versus the expectation of the patient and what they should do. And so there was lots of interesting stuff wrapped up in that about kind of how you impart trust and how you get patients to do what you want them to when they've got the different kind of model in mind.
Yeah, fascinating. So many great kind of different viewpoints. I think what's interesting is like what you were saying about the bots, like the difference between these AI, large language model bots versus like the ones we're used to. Is I was talking to Dawn Anderson, who's like a big name in the SEO world, and she was just saying like, they don't really abide by the same code as the usual bots. They will ignore robot.txt files. They would just hammer your website non-stop looking for stuff, and it's quite a concern of hers that we talk about on the show. And that's the thing, like these, like obviously you build like symptom things like the NHS, it's built for like, you don't really want them like staying on it. That's not the aim of it. The aim is to like help them get to some sort of, conclusion or some sort of like assistance. But these models, and it's been pretty much proven, we've just seen the stuff with social media as well, they're built to keep people on. They want to keep you talking. They want you to keep, asking these questions. That's the whole purpose of them. So that's kind of like a concern. Just open it up if there's anything more people want to add, especially like I know we've said some, but is there like a solution apart from like building some guardrails, but how does that actually look? Because, it doesn't look like the likes of Sam Altman and Mark Zuckerberg and maybe Anthropic, but a lot of the models, they don't seem that bothered about actually putting them in place.
I think from a psychology perspective, it's going to be really, really difficult. I honestly don't know how they're going to be able to do it with the current models right now. It's kind of just feeding into things like confirmation bias. So people are searching for something, they already know what they want. And then I played around with it a few times, and instead of coming back and actually challenging you on that point, it will be like, yes, this is what's happening. A bit like the example with kind of like your neighbors watching you. It's not going to turn around and be like, no, go get help. Your neighbors are not watching you. It'll be like, yes, this is what you need to do. So yeah, like, I don't think I have any real hope that they're going to do that. I think maybe just more awareness for medical professional. I think we need to regulate the internet more when it comes to things like forums and where people find information in the first place, increase digital literacy. So people actually understand how things work and know that, you know, they can't just shove things into ChatGPT and then expect like a qualified answer. But will people listen to it? I don't know how receptive individuals will be. They just want the information and they want it fast. And unfortunately, it's going to be medical professionals who I think have to pick up the pieces in this case.
And I think we've just seen some data from Ipsos saying that, you know, I think it is 8 in 10 GPs every week are dealing with misinformation now. And I was with an oncologist on a panel discussion recently saying that she's actively having to counter some of these false narratives around chemotherapy treatments that would work for people. So I think we are seeing real health impacts from this now, but they're certainly not going to self-regulate. I don't think, well, I think we've seen that and they're not interested. I think there's some interesting moves happening legally. I think the antitrust investigation that the EU launched in December on Google in particular is quite interesting, and that could be promising, but that's coming very much more from a kind of copyright and royalty type perspective, because Google's answer at the moment is either you allow our access to our bots or we don't list you. So you're stuck between a rock and a hard place. And I think that's really difficult for commercial publishers. I think it's absolutely immoral when we're talking about organisations that are health charities that invest an awful lot in producing quality content that then is ripped off, mashed up, and there is no onward signposting. So I think fundamentally it's not going to happen unless we get regulation, and we all have to press for that. But the only other thing we can do is education. I think the NHS has got a role to play there in educating people around where to look for health information. And we have been doing some work with the health literacy team and the health inequalities team, because what we also see is people who are already experiencing health inequalities, particularly ethnic minorities, are much more vulnerable to misinformation. That's almost sort of double the rate because they're not necessarily trusting the accredited sources. So all of these things tie into the objectives that the government's trying to achieve with health. We're looking at sort of sickness to prevention, all of these things. But unless we get a handle on controlling the digital environment, we are going to see worsening health outcomes. So I think we've really got to start evidencing the impacts of this now. And there has to be some control from government. I think the difficulty I'm seeing is that this government seems very pro-AI and is very reluctant to put any criticism against it. And sure, I think there are great advances that are potentially could be useful for patients, diagnostics, even just in clinic letters. I had a clinic letter come back the other day. It's completely inaccurate. If that had been kind of transcribed by a sort of AI tool that the doctor could have corrected instead of having to do something herself at the very end of time, that would be great. That would save everyone money. But I think it's regulation and public education. And I think there has to be a role for government and the NHS and all of us working together in that.
When you get kind of the clinical scribes and things like that working together, I know there's lots of trials kind of beginning with that at the moment. So where AI has the power to sort of sit there as a buddy to the clinician or whatever, and there is a human in the loop, you'd hope, in order to kind of try and make sure that those inaccuracies are being spotted or any hallucinations are being spotted. That's why it's so important to do that kind of testing to make sure that it's actually useful.
I was just going to say about the minorities as well. That's super important because the data that is trained on there is so much less health information in different languages. And the biggest problem is in different countries, they have different, mindsets, I would say, towards different health problems. I can give you an example from the Czech Republic where I'm from, that, for example, neurodiversity isn't really a thing out. So I have seen so many examples when it comes to things like ADHD, where like the top ranking content on Google is actually ADHD is caused by sugar, all of those kind of things that we kind of debunked about 20 years ago. So when these AI tools are being fed with information like that in a particular language, of course it's going to throw up that, ADHD is caused by sugar and all of this different misinformation. And no matter where somebody lives, if they're good, like searching for information in Czech, they're going to come up with everything, and people don't necessarily have the medical skills, critical thinking to be able to think, oh, maybe this isn't right. And I actually know people who have kind of taken action based on ChatGPT and stuff like that. And for example, ban their kids from doing certain things or not allowing people to do certain things. And it's actually quite sad when you think of it because, not very true.
I think one of the key things that would be really useful is more verification and validation. And obviously, what Sophie's doing with Pivoting is massively, massively helpful. And on YouTube as well, they have a health shelf where you have to be an accredited doctor with a GMC number or other proof that you are a qualified clinician to be talking about this subject. And I think that if that was just introduced within the AI answers or within websites themselves, I think that would go a long way with patients, just validating what patients are seeing, that it's come from a trusted source, that there was a human in the loop. And I don't think that it would even be that difficult for the companies to do it, but it's around incentives. And as somebody else mentioned, I think a lot of it is around money. So perhaps once they can see some profit from it, then it's more likely to come about. I'm not sure.
We were really in that health shelf setup, and I was talking to one of the people who was working on it, and they were having trouble getting those that validated health shelf content raised up the algorithm to go into the AI overview. So in the same way that they're not looking at validated content sources, it's just as likely to pull in an influencer to one of the verified healthcare professionals. It seems to me that ethos of verification they've stepped away from since we've had a change in government. I think it's quite clear to me, because that YouTube health shop is now health shop and children in one department. So it seems to me there's a less investment now, and I think that's directly related to the change in political environment in the era.
If I could just add another point to it, talking about the value of clinician verification for the information that's there. Part of my clinical role is educating students, and we have found quite a lot of students using AI for their studies, which is watering down their information. And actually, we've had to feed back quite a lot of concerns to the universities that we are asking for maybe case studies of a clinical situation that they've encountered on their placement with us. They've handed it over to us, which has been, 8-page reams of, a case study is supposed to be a reflective learning point through their practice. And it's all AI generated. So, not to extrapolate too far from that, but if we know that the students, tomorrow's generation of healthcare professionals are using it through their learning, there is the concern that it's diluting what they're actually learning at university level too.
Can I add in? Yeah, I think from all of this, I feel like I'm too small a cog in the system to have any influence over pretty much any of this, which I guess is how a lot of people are feeling at the moment. I think regulation is really important because, as everyone said, this is probably the most powerful people in the world who have the most money, who are dealing with how this gets into people's hands at the moment. And there's no, unless there's external regulation rules that they need to follow it, which will impact how much profit they can make, it's not going to make a difference. But I also think regulation is slow. There's plenty of regulation out there at the moment for websites, health websites. If you want to be legit script certified, for example, there's a lot of stuff that you need to do in order that process to go through in terms of information on your own site and health policies and that sort of thing. But the internet doesn't care. There's just so much health misinformation out there across YouTube, across forums, TikTok, just everywhere out there. Misinformation is already here, and we're already kind of combating it in everything that we're doing, regardless. And a lot of people don't care. They're going to consume the misinformation anyway. So I do think we need an alternative that fits somewhere into the health system. I think the NHS is going to need to get very uncomfortable in terms of speed of adoption, which I've seen in my practice is incredibly slow compared to private sector. And I think providing an alternative that does have guardrails, that does have good pre-training data that comes from verified health sources, that does have a pathway through to healthcare professionals at the end of it somewhere, I think is necessary. I've used AI, I've used ChatGPT in my own health concerns in the past year. It's given me wrong answers, but I'm a health professional, so I know that they're wrong answers and I can use it more as advice. But that's because I have lacked access because the system's struggling. I've still got, I think, about 6 months before my ENT appointment to actually get the answers that I need. So it's going to come in somewhere. People are going to need to use it. And I think the NHS is going to just need to get really uncomfortable and adopt something that's better than what we have at the moment.
Yeah, all great points. And, that's the thing with Google now. Like, we know when you go on AI overview, their whole thing now is to then get you onto AI mode. So you go onto Google. It's not about referring people to the right website. It's about how can we keep you on the platform? And then they're going to bring in agentic AI. So what they already have. So then that's do everything on the platform. You don't even need to leave. You don't need to go to websites. You don't need to talk to anyone. We can do it all here. And, the thing is about people say to me, and I keep hearing this, and they'll be like, well, people just will stop using it. They'll stop going. I know some people are trying to not use AI, but the thing is, we don't control that. Google, everyone's grown up, generally grown up using or got used to using Google or things like that. Generally, Google is like the main search engine, and all their devices have got all these things built in. So Google want to go full AI, which they are. Then we have no control. We can't just say, oh, well, we're not going to use our phone anymore. We're not going to search for things anymore. It's like it's not in our hands. I think they control how humans behave in a way. Roger.
Aspect written in our hands. So if some of us are sat on kind of the repositories of content, and so part of what I'm interested in is how we mark that content up with schema, and metadata, and taxonomical structures, because then as the sort of content owners, we become the sort of owners of meaning, but equally, and that meaning these days is machine readable as well. So trying to clarify what you mean by the adoption of decent, metadata and schema and all that kind of stuff helps a machine understand kind of what you're on about, or what that subject's on about. So that's where I feel like we got some empowerment, is in kind of creating good knowledge corpuses that are well managed and well maintained, with professionals having kind of the right levels of oversight over that. Because with the slow death of browsing web pages, as it were, and that increase in chat-based kind of AI model traffic, then that's where we got that little bit of control, and so that's what I'm interested in experimenting with at the moment.
Yeah, my only pushback on that is that we all know how much health information takes to produce, and if we're not getting any sort of rewards on that, like we're not getting recognized, we're not getting any traffic from it, any of that kind of thing, people are they going to still produce the content needed? Are they going to spend the time to structure it and do the schema markup, which takes a long time? Are they going to, as Sarah said, like there's so many different groups that could be differently affected by searching the same thing. Potentially, you're going to have to cover all that in your content on top of all the stuff you already got. It's like, we're going to, again, do all the heavy lifting. Where's the reward?
Well, it was probably a bit short. It reminds me, I'm old enough to remember what it was like in the late 90s when the kind of web was first coming to proliferation. And so we were exploring at the vanguard of this new world. And it feels like we're in exactly the same place, but just with a slightly different media.
Yeah, I agree entirely. I'm probably also remember that time in the 90s, and it is at that point. But I think, we know that the charities are suffering already. We know from the data that we've collected that they're seeing falls in traffic to their websites because people aren't going beyond that. So we've got interesting policy things coming out now around Diagnosing Connect, which is a very kind of intense way of connecting people with charities. But it's a very small group of charities and it's a very small group of conditions. So if there was a way we could all combine our content and that people could get those, there's a model now that the NHS accepts it needs to pay for the support charities. So if some of that content is getting a bit pulled into these answers, can then some of that money go back into the charities who are producing that content? The NHS can't do it all. And I think with the test that we've been doing with this model that we've been doing, we will be doing a readout on it in the next few weeks. Is that something we really want to try and explore with our charity members now? Can we build something like that where we then, as well as signposting back to the charities where their content is drawn through, that they get some remuneration for that? Because to do health content well costs money. And that's the thing, it's going to eat itself in the end, because if all the great content disappears, what are we going to be left with? And that is quite a terrifying process. That was actually quite terrifying.
I was just going to say, just from a perspective of working with smaller healthcare providers who have spent a lot of money in the past in producing healthcare content. I mean, from my point of view, we've almost stopped doing that now because there's not much point. We're not getting people through onto the websites who might then purchase the services. I mean, that's why they're doing it, is because they're paying money to create the content in order to make a profit. That's just how their private businesses work. Obviously different in public sector. But yeah, if there's not much incentive to produce that content anymore, there's not much that we can do.
I think there's a shift that's happening at the moment. I think that clinicians need to focus, particularly in our sector, James, I think clinicians need to focus a lot on what their specific specialty is. You're not going to rank as for, heart condition anymore. It's just not going to happen. People can get those answers anyway. I think that you can, if you really are niched down to one particular type of patient, then you're much likely to be surfaced for that particular topic in the AI overviews. I think that's where everything's heading now. And just about the point about remuneration for people, I know Cloudflare are doing a lot of work around automatically blocking AI crawlers from going to their sites, and that they're looking at ways of paying content creators. So I don't think it's all necessarily doom and gloom. It is quite a dark time, I think, for the internet in a lot of ways, but I think that there's certainly things that are happening to give publishers hope and charities hope as well, hopefully.
Very quickly, just in terms of that shift, one of the benefits of that is, I mean, for years, people have just spent all of their content money rehashing what's already out there on the internet, just rewriting about the same condition and about the same symptoms, and just kind of fighting it out to get to the top of the page of search. So I think the positive change that I see is people have, especially in bigger businesses that have more money to spend on content, they're looking at thought leadership, they're looking at research, they're looking at giving kind of perspectives that you wouldn't be able to get from AI that are coming from people with real experience. And I think that's amazing. A lot of the blog content that I see coming out now is stuff that I actually want to read, as opposed to stuff that's designed to trick me into getting onto their websites, then maybe I'll buy something. I think building trust rather than rehashing stuff is one of the benefits of this kind of shift with search, at least with health content.
Yeah, and I think trust and authenticity are really the things that are kind of shining through now, aren't they? I think people are becoming very aware. Even Jim down the street, they're kind of becoming aware that there are pitfalls with it, and it'll be on a scale. Obviously, some people aren't going to criticize it at all or question it, but I think there is a growing understanding that the information needs to come from authoritative, trusted, believable sources. It's just a slow tide to turn, I think.
There's some interesting data from the Edelman Trust Barometer that came out January around that, and about the need for trust brokering. But it also, I can't remember the data, it'll slip my mind, but it's quite a high proportion of people who'd followed advice that they had found on either social media or, kind of AI generated content, and then have decision regret. So I think people are going to start having that experience. So I think the trust piece is really important. And I think this uniqueness of content is really important. We always encouraged our members not to duplicate content and to really make sure that there is a genuine need and someone's not doing it better already, because the resources are so scarce. But then that plays well for them in search, and we're really happy to work with Sean earlier in the year to develop the guidance for our membership on how to come up in these searches now. So I think the trust piece is really important. We also know that people are more actively searching for verification signals now because they just don't know. They are really struggling to find out what they can trust, and actually the proportion of people who that has gone up. In the last 2 years, people are struggling to find what to trust has gone up because there is just up to a wealth of stuff out there. I think of that 1 in 2 people in the Ipsos data said that AI is actually making that harder. So I think there is a recognition amongst the public that it is just very confusing, but people are still not quite sure how to navigate. And I think that, that there is a sort of broader educational piece that needs to be addressed as well.
There's been a couple of studies that I've seen actually that kind of show that people's trust levels have now turned really superficial. So instead of actually judging the content, judging, if it was on an actual medical website, they'll go for the flashy website, the new website, if things look good to them. So again, I think that's something that maybe more trustworthy providers need to start looking into, things like web design, how their content is presented, if it's on social media, if it's on the channels that people want to go to. Because even if it's like the best content written by the best doctors in the world, it's most trustworthy. If it's on an ugly website, people are not going to trust it.
Absolutely. There's an attention economy price to it as well, isn't there? It doesn't just need to be right. It needs to be sold in the right way to people almost.
I was just wondering if there's going to be a sort of a rise in the number of companies trying to do deals with the AI companies, a bit like kind of Disney has done with its kind of characters and all that kind of stuff. So you can see that the writing's on the wall, and therefore you're trying to commodify your estate in a slightly different way. So whether or not that's something that the government might address, the NHS might address, I don't know. But I think we're saying to some degree the genie's out of the bottle. So how then do you kind of work with it in that format?
Yeah, that's a good point. I think that will happen. I can see like all the trusted healthcare, partners coming together and supplying that kind of information. I think that is the right, James is right. I'm very doom and gloom on this channel sometimes. I need people like James to come on and be positive about it. But it's true, like it has brought to the forefront like the EAT sort of elements that we want to see, and that is a good thing. Like we are going to see more experts talking about things, answering questions. But I think that's why it's important, like Sarah's touched upon, like we all touched upon, website traffic's going to never come back to the levels it once was. We know that. So that's why it's important we distribute, on the different social networks, on these, different places you could put, we know YouTube is highly, highly influential in these models trainings. So making sure you're putting videos out, because that's going to be then feeding the models all the right information from different sources that they're going to. And also like I have to go there again, doom and gloom, but the problem is with SEOs that we see a shiny thing and we get really excited and we kill it basically. And Reddit is kind of like that place at the moment. We saw Reddit, everyone's going Reddit because they're sick of AI. They wanted to talk to other humans. And now we're like, oh, how can we optimize that? How can we be seen in that? And now so that's the problem we've got as humans and SEOs. We kind of destroy things when they offer in a good solution. So that's obviously something to, and that could happen with all the channels like YouTube and so on and so forth. But I am seeing also more, I think they've started, I think it was maybe just in America, I'm not sure, but someone saying it might be in Glenn Gabe, but he was saying he's seen labels underneath the AI overviews about this, warnings and basically stuff like about risk and stuff. So that's a step in the right direction, I think, that they're trying to take.
Do you think there's something to do around prompt engineering and kind of how we educate people to kind of create decent prompts as well? So I know that I've seen across government recently a site that is kind of being proliferated with prompts that have been well sort of curated together in order to kind of, whether it be to help write a business case or something else, then maybe there's a use case out there for, decent prompts surrounding health information and how to get the best out of the tool to minimize the kind of risk that you're being exposed to. That's just not off my head.
Yeah. And I just think it's amazing because, like, if you work in government, you work in the technology department, AI didn't come from anywhere. Like, it's been around since like the 70s. We knew it was coming at some stage to the general public. It's not like it just one day came out of nowhere. So where was like the planning, like to roll it out to people? Like where, like COVID, like same thing. I mean, it came apparently out of nowhere. Then we kind of put together this big plan and executed it to the whole public. What we should be doing the same with AI, because it has dangers similar, not maybe the same scale, but it has a lot of dangers that comes to it in all different ways. I think we should be doing a large scale operation to try and get that awareness out on the same levels, really.
I think it was really interesting a couple of weeks ago, I think it was, that Google came forward and said they're going to start using more personalized data to help inform their AI algorithms. I think it's starting off in the US for individuals that are signed up to labs, but actually taking people's Gmail content and their photos. It almost goes to Roger's point, talking about prompts. I'm not sure if we're going to need to rely on prompts so much, because Google's just going to go, do you know what? We've got all this information about you already. Here's the answer that you're looking for before you've even typed it in. I think it's quite scary. And I think that's something certainly in healthcare where it's definitely going to be one to watch. And I think it's quite a scary sort of step forward for technology when you see a company doing that level of personalized espionage.
Yeah, I think that's genuinely terrifying. But I mean, we have tried to do some public work around prompts, but we've just got such a small voice. So we can amplify that through our membership. We're working with the Health Literacy Partnership, which is working with the NHS team through public libraries and sort of suggesting people add UK. So it's specific, asking to look for either, trusted, PIF tick providers for their health information or the NHS, and sort of, putting better prompts in to get better answers. But I think we really need to be working much more closely with education at this point as well. There's an awful lot of stuff that we know is, particularly young people using these models. You mentioned, Gavin, around students using it. My daughter's academic. She has exactly the same problem. She was based in Wales and refer people to whose dissertations, good students who put too much through, AI to create them. But I do think there is there's such a crisis in young people's health and mental health at the moment. So I think that, we've seen stuff about media literacy. We've got the whole kind of emphasis on children and young people's health in the NHS plan. So some of this has to go into education about how to use these models, how to access health, how to find health information, and how to manage your well-being.
Yeah, I was listening to Sarah from the King's Fund talking this morning about sort of kind of declining health in old age. But let's move it right back to the beginning. It's going to be really difficult. And then this needs to be part of that general health education and self-care education, I think.
So I was listening to the co-founders of DeepMind talking about how they think there needs to be a substantial increase in the amount of deans from the Russell Group universities in the UK beginning to apply their subject matters about all the things that these universities are teaching based on an AI and agentic-based future, because that's where kind of some of that kind of information needs to be driven from. So if they're already saying that from companies like DeepMind, then the writing's on the wall, isn't it, to some degree?
Yeah, it's like you say. The thing is, even people who work in digital and tech are still getting used to actually understanding how these models even work, and many still don't really understand it fully. And like we said before, rolling it out to the general public, they just see it as this, like, they don't even know really what it really includes. It's like it's like a new Alexa sort of thing, like ordering your groceries, but it's like, it's totally not that. And the problem it has is like you say, Sophie, I think this is like the right thing. What they could do is, like, when you put in a prompt, questioning the person, if it's based around health or anything like money, financial, anything, your money, your life bucket, saying, are you sure, like, maybe you want to adapt it like this? Are you sure you want to ask this question? And the problem is they don't have the ability to say, I don't know. That's the problem. They never say, I don't know this, or very, very rarely. They just give you an answer. And like we've been saying, it's kind of like confirmation bias. And yeah, we said in the past on this channel, like, if it says something that backs up what you was kind of hoping to see, you're not going to go and get a second opinion, because you're like, oh, okay, good, thank God for that. But if it doesn't say something, then you're going to panic, you're going to get anxious. It's not a good thing either way, in my opinion. But yeah, we'll wrap it up. I think it's awesome. Well, not awesome, it's scary, but a very informative conversation. I really, really appreciate all your time, and thank you for joining me today. It's been really fascinating.
Thanks, thanks.
Thank you.
Great to chat with you all. Thank you.
Thanks.